Good morning. I'd like to wish everybody a happy 2023, Happy New Year. I wanted to make a very short video for you so that you can get an idea of some of the basic, simple spinal exercises that I've done over the years that are real easy to do, very easy to follow, and very dynamic. And you can do them first thing in the morning, before you go to bed, and it takes a grand total of just a couple minutes. So I'm going to demonstrate those for you right now, and then I'm going to demonstrate the simple traction maneuver that you've probably seen me recommend to you. Unless you're already doing it, then you already know about it. But the first thing is this: when you, let's say for example, you wake up in the morning. When you sit up out of bed, you could go like this, so very, very slowly, just like this. A few head rolls, very, very, very slowly, very, very slowly. And then you could do the neck, the head down and back, head back and forth. And what that does, that activates your nervous system. It's telling your system, okay, I'm up, I'm getting ready to get fired up, and I'm going to start the day. The next thing you can do is just sit on the edge of the bed, or you can even do this in your chair at work. You can do it any place. You sit like this, your hands behind your neck, look up at the ceiling, shoulders back, chest out, pull your stomach in, and you just swivel. And you just swivel to where it's comfortable, or to where you feel a little tension. That's it, just like this. Just swivel just a very, very little bit. And you can do 5, 10, 15, 20, however many you want. That's activating the spine and the little spinal muscles and activating the nervous system. So you can do this just like this. You'll feel it in your shoulders, arms, elbows, back, maybe even into your pelvis and your hips. And then when you're done that one, you put your hands behind your back like this as best you can. Now I can do this because I do it all the time. But if you're like this, that's okay. Your shoulders might be tight. You hold it and you count to 5, and then you can relax. Hold it and count to 5, and you can relax. Or you can just sit like this and count to 5 or 10. That has activated your neck and back and nervous system very well. Now, another one that's a little bit more aggressive, not yet, I'll show it to you in a minute. The other one is you can sit in a chair and you can just go like this. You're not pushing, you're just raising your legs, and that's stretching your calves, your feet, your hamstrings, and working your pelvic muscles just a little bit. And then another one you can do is to sit and maybe just sit back a little bit, and you push like this until you feel it in your stomach, and that's activating the stomach muscles and the core muscles, and then you can relax. Now, let's say you're out of bed. What you can do, if you have a door, and I'm sure you do, you just get on the door like this, and you put your feet shoulder width apart, and you just go down very gently, and then you come up. You straighten your arms, you go down gently, and then you come up. Straighten your arms, go down gently, and then come up. And then when you've done so many of those, let's say 5 or 10 of them, you can sit like this, and that keep your arms straight, and that stretches out your arms, your back, your pelvis, your low back, and then you come up very, very, very slowly. That is fantastic for the backs. And then, if you have time, if not right away, another time during the day, this is the famous traction maneuver that I have had so much success with patients over the years. You put your feet, this is an orthopedic cushion, so I don't have these at the clinic, but we do have these blue ones. And there's other ones too, but this is the ones we've had the most success with. So you're tractioning the low back with this. You're setting the pelvis with your feet up on a chair, and you're setting the neck. What this is doing is promoting normal spinal alignment as best you possibly can, opening up the nerve channels, taking the pressure off the discs, and promoting the ligaments to get stronger to hold the bones in place. You should do this for at least 20 minutes at a time. A lot of patients will take a nap, whatever. Just lay here and rest. On the floor is best. Sometimes you have to do it in the bed because you can't get on the floor. And another one is this in the bed. You just lay like this in the bed. If you do this before you go to sleep, you're promoting normal alignment, opening up the disc space, opening up the nerve channels and the circulation. If you do it in the morning when you wake up, you'll notice yourself perhaps being less stiff in the morning when you get out of bed before you do the other exercises. And then when you go to get up, remember this. You're like this, and then you roll to your side, and then you sit up. That's the little exercise routine that you can do very simply every day. It takes about 5 minutes, and it will help you tremendously. If you have any questions, you give me a call and I'll go through it with you at the clinic. And we also have these cushions if you want them. Just give me a call if you have any questions, and I'd like to wish you a happy and healthy new year.